Analytics and artificial intelligence go together, but analytics have been used in healthcare for decades. They've played a central role in helping us improve the healthcare of patients for decades, but also improve our healthcare system, especially here in the US, by trying to understand how it works, how great outcomes are delivered. But that can be really hard. As you can imagine, the human being is a pretty complex organism, and there's a lot of heterogeneity in us as human beings, and that's reflected probably in our healthcare system to some extent, to a great extent. There's a lot of heterogeneity because it's adapted to a very complex problem, delivering healthcare. Um, Analytics in healthcare over the past few decades has strived to try to get to common units of analysis at times. So we could understand better what's working, what's not working, how costs are distributed, how care is distributed, how it might vary across this very heterogeneous system. Um, and that's not an easy task. For decades, we've used rule-based analysis to try to get at these common units of analysis. If I see this, this should be classified this way versus that way. But we know that rules can be constraining at times. And so in an effort to try to get better at this, new methods have been introduced, sort of statistical reasoning and structured data, where we try to best fit to the data that's available to us, has been an incredibly important part of healthcare, and and something we've used to understand trend, understand how to serve populations better. And now, in the last few years, with the renaissance of artificial intelligence, primarily driven by machine learning, we now have new tools to allow us to, almost to some extent, but not completely, disregard that heterogeneity, if we can sort of not worry about the features or the structure that we pass into a method. Can we still classify things? That's sort of at the heart of some of these new breakthroughs like deep learning, a type of machine learning. And with the application of these new methods, we're now on the cusp of really saying, how can we apply the best methods with what people need to make great decisions, whether they be a provider or a payer or a consumer? How can we grab the best methods, can apply them to a problem, provide people with information that synthesizes a very complex information space, and do that safely and appropriately, but do that in a way that helps people make better decisions and augment their intelligence. And that's what we're really excited about, and the journey we're on with this type of innovation.